So I remember, I think it was a couple of years ago, I had a patient, so I was on call, and the nurses called me because there was a patient on the ward who had got an interaction with the on-call doctor that wasn't going so well. The patient was somebody who had a chronic debilitating condition, and pain was a factor of it, but there was, there's something that we weren't able to cure. It was just something that we were managing, and this patient was in the hospital, and unfortunately their interaction with the junior doctor on call was described by the nurses as being quite offensive and disrespectful. So I went to speak to the doctor, and I don't mind saying he was close to tears. I had a look at the patient, and there were some things that we could change from a medication point of view. So the patient was sorted out, and I sat down and had a conversation with the junior doctor, and it was interesting. I found myself saying, so you will have heard this phrase that pressure shows you what's on the inside. It's this concept of crushing grapes is the thing that gives you the fruit or the juice. That's how you make wine. And what I said to him was, because we've all seen this, there are people in life that you just can't keep down. No matter what happens, they are taking life by the horns, and they are happy or motivated or just go getting. And there are people who you can't get up, no matter what happens. They're like a sourpuss, always looking for the negative in the situation, or always be negative, say negative. And I think especially at work, if you come into contact with enough people, one of the things I've realized that it's not the situation. So I've seen loads of patients with horrible diseases, and that doesn't change. Well, it doesn't automatically make the interaction with the patient tense or fraught with problems. They're nice people, and there are people who may comparatively have something that's not as debilitating, or not necessarily associated with significant pain or discomfort, and interactions with these patients can sometimes be, again, either fraught with shouting, or it's tense. So it's not the thing. It's evidently what was in them in the first place. And this is what I said to this young man. I said, especially in these situations, when you're trying to provide a service, it can make you doubt yourself. Did I do something wrong? Did I say something wrong? Was my manner a certain way? And whilst we have to take responsibility for our actions, especially in a professional environment, and if there's something to learn, then let's learn it. We could all improve our communication skills. But I think it's also important to remember that everybody is human on both sides of that interaction. The patient is human, the doctor is human. And it makes me think of lots of different things, that kind of interaction. So there's a psychological concept called internal or external locus of control. It's basically how much I as an individual feel like I contribute to the situations that I'm dealing with in life. External locus of control is nothing to do with me. So if it's good, it's luck. If it's bad, somebody did something to me that I didn't get taught in school, my family situation, my boss, all that kind of stuff. And if I have an internal locus of control, irrespective of the situation I'm in, I'm able to decide either to make a change or take responsibility for negative things, make decisions to alter course, or enjoy things that are happening in life because I know that I contributed to them by choices that I make. And I think, there's some, again, from a psychological point of view, there is a thing called negativity bias. So the thing to understand is that what they say in the concepts is our brains are wired to keep us safe. So we're always looking for the danger, or a negative thing. And I think that actually most people in society would identify to some degree with an external locus of control. The thing that's important is that, again, let's look at the population and look at people. Because of these things, there's somebody who will lose their job or may get a negative diagnosis and be like, oh, what am I going to do? How am I going to move forward? May have concerns about the future. And there is somebody who gets the same information and gets another job, or decides to not let the condition define them. And the really important thing from a health point of view is that actually there have been studies to show that having a positive mental attitude is beneficial from a health point of view. So did you know that people who have a positive mental attitude recover quicker from surgery, tend to have better outcomes from surgery? That's been proven. Just the way that I look at life, which is a non-physical thing, will determine a hard physical outcome. It's really interesting. From a medical point of view, as a doctor, I know that my interaction with the patient and whether they have confidence in me often determins their outcomes in terms of complications after a procedure. Let's say I'm doing a lumbar puncture or taking fluid off a lung or something like that. Again, a non-physical thing, the way that they see me, will determine a hard physical outcome, complications afterwards. So it's really, if you never thought it was important how you look at life, you've never thought about it before and maybe thought about, that sure it's got nothing to do with my health. It really does. How we look at life genuinely affects our health. So, maybe have a look at positive to negative mindset. Maybe have a look online at internal, external locus of control. There are some things, there are some questionnaires that you can do, because I think before you can make a change, or to even decide whether a change is necessary, you need to figure out where we are. You can figure out, am I the kind of person that looks at life and think, I have no control over this? Or am I the kind of person that says, actually, like, does it matter who the Prime Minister is or the President? Does it matter what's going on from an economy point of view? Because these things are happening, but the outcomes are going to be determined by how I choose and my mindset. Let me know what you think.